Hi, my name is Dr. Ellissa Tiller. I'm the Hospice Medical Director at HopeWest. My talk today is called Mask Yourself, Do I Feel Lucky? I had a little bird. Its name was Enza. I opened the window and influenza. In 1918, the Spanish flu spread quickly around the globe at the end of World War I, killing 20 to 50 million people worldwide. Effective medical masks were relatively new at the time. Masks had been developed over the ages in an attempt to protect doctors and nurses caring for the sick and dying. During the plague in the 1600s, doctors wore bird-shaped masks with beaks. These masks had nostril holes for incense. The miasma theory of disease transmission at the time proposed that breathing in foul-smelling plague air caused disease and death. However, covering up the smell of plague with incense unfortunately did not protect doctors. The germ theory of infectious diseases being caused by microorganisms became the dominant theory in the 1880s, after research conducted by Louis Pasteur and Robert Koch provided a sound scientific basis. In 1910, a very deadly pneumonic plague broke out in Manchuria, now northern China, and 99.9% of those infected died. The Chinese imperial court appointed Malaysian doctor Lien Te Wu, who trained at Cambridge University, to lead the public health effort. Dr. Wu theorized that the plague was airborne after performing an autopsy on a deceased victim, and developed a mask made from gauze and cotton. A prominent French physician, Dr. Gerard Mesny, openly disagreed with and humiliated Dr. Wu. Dr. Mesny attended sick patients at a plague hospital without wearing a mask. He died 2 days later. Dr. Wu's mask and his insistence on cremating the deceased were breakthroughs in helping contain the spread of the plague. Masks then became adopted by the medical community in general, and Dr. Wu ended up being nominated for a Nobel Prize in Medicine. 8 years later, in 1918, just over 100 years ago, the Spanish flu infected a third of the world's population. There was a high mortality in healthy 20 to 40-year-olds. It also killed children under 5 and adults 65 and over. Companies and volunteers increased the production of gauze cotton masks. Areas of the western United States that had better compliance with mask wearing had lower death rates. Ultimately, though, 675,000 Americans died of the Spanish flu. That's almost 6 times the number of those killed in World War I. Mesa County in western Colorado had a population of 11,500 people in 1918. 171 people contracted influenza. Schools were closed in early October 1918 after the first death in Mesa County, and before the governor of Colorado closed all schools, churches, and government buildings, and banned large gatherings of people, including public funerals. During the worst part of the flu, the American Red Cross opened an emergency public hospital in Grand Junction on Halloween, October 31st, 1918. Dr. William Shapley, Denver's manager of health at the time, advised the public to cover their mouth when coughing or sneezing, avoid tight shoes and gloves, breathe deeply when the air was pure, and to remember the 3 C's: clean mouth, clean heart, and clean clothes. There was an order in Colorado on November 20th, 1918, for the public to wear masks. The order was rescinded only 9 days later. People thought that wearing masks was bad for business, and they were concerned about their civil liberties. There was an incident in San Francisco on November 27, 1918, where a special officer for the Board of Health shot and severely wounded a man who refused to wear a mask. So here we are in 2020 with another world pandemic. The new coronavirus, COVID-19, is spread from person to person via droplets, through the air, and when someone touches their eyes, nose, or mouth after touching something that an infected person has touched up to 3 days previously. While cloth and plain surgical masks don't protect as well as N95 masks, they do reduce risk of COVID-19 substantially if both the infected person and nearby people wear a mask. There is also some evidence that people are contagious 2 days prior to developing symptoms of COVID-19, and up to 20% of people with coronavirus never have any symptoms. So even if you're feeling fine, you could give COVID-19 to someone else without realizing it, or they could give it to you, unless you both wear a mask and practice social distancing. Given that coronavirus can buy you a ventilator and time in the intensive care unit, or even cause your death, wearing a mask in public makes a lot of sense. I would encourage you to buy or make a mask for yourself and your family. Stay home as much as possible. Get pickup for groceries and other necessities, and wait for an effective vaccine before venturing out without a mask. Mask yourself. Do I feel lucky? Don't end up like the old children's rhyme. Ring around a rosy, pocket full of posy, ashes, ashes, we all fall down. Go get yourself a mask. Thank you.